Hello, my name is Steve LaCroix. I'm the Clinical Manager for EMS Products for Mercury Medical. Now we're going to be talking about the NEO-T Infant T-Piece Resuscitator, the only one from Mercury Medical. The NEO-T can work off any standard flow meter that you may have in your facility. You won't have to buy any special equipment to make it work. It can also work with a portable tank. You can see that it hooks up to the regulator that goes on a standard E or a D cylinder. So it doesn't require any purchasing of additional capital equipment. According to the neonatal resuscitation protocols, it's always a good idea when you're ventilating a patient of this age and this size is by using a blender. The same protocols talk about using a T-piece resuscitator over a bag valve mask or a high flow mask of some sort because you get more consistent pressure, you get more consistent volumes. It also cuts down on the fatigue of the rescuer because it's just a very tiring thing to do if you have to do it a very long time. You'll notice that the PIP controller is only 12 inches away from the mask. This makes it much easier for the clinician to be able to make adjustments instead of having to reach back to a flow meter, which may not be in close proximity. This has the standard DISS connector, so it will also hook up with no problem, such as the other NEO-T. And it comes with a mask. We have several different types of masks that can be ordered to go the design that you desire. The NEO-T is designed for patients that are 10 kilograms or less. So this is for the small infants and newborns. Now the first thing that you want to do, and I'm going to demonstrate that here, and there's some numbers that you may want to remember, is you're going to turn your flow meter on to 10. That's the first number we're going to do. The second thing is we look at our PIP controller and we're going to put that up what we call 12, which is really on the face of a clock, the 12 o'clock position. Our goal is to have 20 on the inspiratory side in your PIP and 5 on your expiratory side with your PEEP. But to get started, you got to put it somewhere. So we're going to go 10 on the flow meter, which is going to help with this. You're going to get 12 here, and our adjustment on our PEEP will be the turning of this blue knob, which I'd really like to have is 5. To measure that, to make sure that we have that, we come with a cap that's tethered to it so you can't lose it. That's helpful. You could put a test lung on there. You could even put your finger over it. I like the idea of using the cap. Now to test that, you put the cap's covering one end, your thumb goes over the other, and you can actually read and see what your PIP pressure is going to be. If you take it and do it this way, take both of them off, you can actually see what your PEEP pressure is by adjusting that, and I've got that at 5. Now the directions of use for this device is going to tell you somewhere between 5 and 15 liters. If you put it on 5, you're not going to be able to get probably the PEEP pressure that you want to have, or your PIP's not going to work to what you want it to be. 15 is probably too high. You're going to get up to, or have the ability to get to 15 centimeters of water pressure with PEEP. However, in most cases that's not necessary. You may have to make some adjustments on some infants strictly because they may have those first few breaths after birth take a lot more pressure to open up the alveoli. They may have a surfactant problem that may cause them to have a little bit more pressure to also open up the airway. So you take your cap off, you put your mask on. Now when you're looking to resuscitate someone of this age group, a mask, the proper size mask, will cover the nose, the mouth, and part of the chin, and not covering the eyes. Places we want to avoid are the soft areas under the chin that can occlude the airway. I also don't want to hyperextend the head too much. That also can occlude the airway. So I'm going to put the mask on. I'm going to try to keep my fingers in what some people call a CE type configuration with the shape of my hand, but I want to keep my fingers on the jaw and put some pressure in to get a seal. This is where the easy part comes in. Instead of squeezing a bag with no consistency, all I do is put my finger over the hole. If I put my finger over the hole, and then I watch for chest rise. To have something as simple as this, that I can watch my pressure when I do it, I can change my PIP to get the chest rise that I want. It's a much safer device than what we're currently using.
The infant transport mattress warmer is supplied in a box. Open the box Remove the mattress warmer, and looking at the clear side, you'll find a small disc in the fluid. Bend the disc to break it. This will cause a chemical reaction to take place that will spread throughout the warming mat. There are instructions printed on the clear side of the mat. The mat will warm up to 104 degrees. Place the clear side down and place the infant on the protective side. Then cover the top of the infant.